Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating case study that highlights the successful, long-term management of transitional cell carcinoma in a canine patient, offering a beacon of hope for treating this challenging condition. Transitional cell carcinoma, or TCC, is the most common type of urinary bladder tumor in dogs. Unfortunately, these tumors are often difficult to remove surgically due to their location in the trigone area of the bladder. As a result, chemotherapy is frequently the primary treatment method. This case study explores an innovative approach using Sorafenib Tosylate, a tyrosine kinase inhibitor, in conjunction with piroxicam, to manage an incompletely resected TCC in a dog. Our story begins with a 12-year-old spayed female Maltese, weighing just 3.6 kilograms, who was referred to a veterinary hospital due to a 2-week history of frequent blood in the urine. Initial treatments with Amoxicillin and Prednisolone at a referring hospital provided only temporary relief. Upon examination, the dog presented with mildly enlarged left mandibular and bilateral prescapular lymph nodes. Blood work revealed elevated levels of alanine transaminase and alkaline phosphatase activities, as well as increased lactate and blood urea nitrogen concentrations. Radiographs showed an irregular margin in the urinary bladder, and abdominal ultrasound revealed a large, heterogeneous mass attached to the cranioventral wall of the bladder. Based on these findings, the veterinary team considered several potential diagnoses, including TCC, Botryoid rhabdomyosarcoma, Leiomyosarcoma, Leiomyoma, and polypoid cystitis. To determine the exact nature of the mass, an ultrasound-guided traumatic catheterization of the urinary bladder mass was performed. The subsequent urinalysis indicated the presence of red blood cells, and the urine protein-creatinine ratio was elevated. Cytological evaluation of the mass suggested TCC, characterized by the presence of Melamed-Wolinska bodies, bizarre mitotic figures, marked nucleoli, and significant variations in cell and nucleus size, indicative of moderate to high malignancy. The TCC was staged as T2, N0, M0, according to the World Health Organization criteria. Given the potentially resectable nature of the mass, the dog underwent tumor excision via partial cystectomy. However, due to the extensive distribution of the mass, complete removal with clear margins was not possible. Histopathological examination confirmed the diagnosis of TCC, with neoplastic cells extending to the surgical margins. To address the incomplete surgical margins, the veterinary team initiated adjunctive chemotherapy. While awaiting the results of a chemosensitivity assay, the dog was discharged with a regimen of piroxicam, misoprostol, omeprazole, and ursodeoxycholic acid. The chemosensitivity assay was crucial in guiding the selection of the most effective chemotherapeutic agent. Tumor cells from the resected tissue were cultured and treated with various chemotherapeutic agents, including sorafenib, carboplatin, mitoxantrone, piroxicam, gemcitabine, vinblastine, and a combination of sorafenib and piroxicam. The results indicated that sorafenib, mitoxantrone, and the combination of sorafenib and piroxicam were particularly effective in inducing tumor cell death. Mitoxantrone demonstrated a 100% tumor cell death effect at 25 millimolar, while sorafenib alone and in combination with piroxicam achieved the same result at 50 millimolar. Despite the effectiveness of mitoxantrone, the owner was reluctant to use it due to its nature as a primary chemotherapy drug. Consequently, the veterinary team opted for oral administration of sorafenib at a dose of 5 milligrams per kilogram every 12 hours, based on the chemosensitivity assay results. 6 months post-surgery, the dog returned for a follow-up examination. Physical examination revealed the dog was overweight and had mildly enlarged bilateral prescapular lymph nodes. Blood chemistry showed elevated alkaline phosphatase activity, blood urea nitrogen, and creatinine concentrations. Urinalysis revealed numerous red blood cells, white blood cells, and atypical cells with variations in cell and nucleus size, multinucleation, and rod-shaped bacteria. Ultrasonography identified an isoechoic to hyperechoic pedunculated soft tissue mass attached to the cranioventral region of the urinary bladder. Due to the kidney injury, the dose of piroxicam was reduced. The use of a chemosensitivity assay is crucial in determining the most effective anticancer drug for each patient, given that different drugs have varying median survival times in dogs with TCC. In this case, the assay indicated that both sorafenib and mitoxantrone were effective. Sorafenib. While a previous case report showed limited success with sorafenib and piroxicam in a dog with metastatic TCC, resulting in a survival time of only 96 days, the outcome in the present case was significantly more positive due to the absence of metastasis and the targeted use of sorafenib based on chemosensitivity assay results. This underscores that survival time after sorafenib administration can vary depending on the presence of TCC metastasis. The success of this case suggests that when TCC responds to sorafenib, long-term survival is achievable even with incomplete surgical margins after partial cystectomy. Therefore, sorafenib tosylate can be considered as an adjunctive chemotherapy option when maximal surgical resection is performed and no metastasis is detected. However, it is important to acknowledge the limitations of this case report. First, while piroxicam is known to be effective in canine TCC by inhibiting tumor angiogenesis, the in vitro chemosensitivity assay could not fully capture its in vivo effects. Thus, it is not possible to definitively conclude that the successful long-term management of the tumor was solely due to sorafenib. Second, the mass-like lesion observed during follow-up ultrasonography could have been either a recurrence of the tumor or a surgical scar, as further diagnostic tests were declined by the owner. Nevertheless, the stability and size of the lesion, absence of metastasis, and lack of clinical symptoms suggested it was more likely a surgical scar. In conclusion, this case demonstrates the potential of sorafenib tosylate for the long-term management of TCC in dogs, particularly when metastasis is absent and surgery is performed to resect the tumor. The dog in this case experienced over 900 days of management with sorafenib tosylate without significant clinical symptoms. Although existing studies have not extensively documented the use of sorafenib tosylate for canine TCC, this case suggests that it could be a viable option after surgical resection, even when TCC cells extend to the surgical margins. Sorafenib may be a potential therapeutic agent for managing canine transitional cell carcinoma, TCC, with clinical evidence suggesting successful long-term management. A study reported successful long-term management of TCC with sorafenib tosylate in a dog based on a chemosensitivity assay, CA. The dog lived over 2 years without clinical signs or tumor relapse after surgery and postoperative sorafenib tosylate and piroxicam administration. Mechanism of action. Sorafenib is a receptor tyrosine kinase, RTK, inhibitor targeting factors like rapidly accelerated fibrosarcoma, vascular endothelial growth factor receptors, VEGFRs, platelet-derived growth factor receptor B, PGFRB, and c-KIT. It may directly target tumors and inhibit angiogenesis, crucial in TCC management. Case study. A 12-year-old Maltese dog with TCC was treated with sorafenib tosylate after partial cystectomy, guided by a chemosensitivity assay showing sorafenib's effectiveness. Extended survival. The dog was managed for over 2 years, 900 days, post-sorafenib tosylate, without significant clinical symptoms or metastasis, while TCC cells remained in the urine sediment, indicating management rather than cure. Survival exceeded typical median times with other anticancer drugs. Post-surgical option. Sorafenib tosylate can be considered for managing TCC in dogs post-surgical resection, even with incomplete margins, especially without detected metastasis and after maximal surgical resection. Targeting growth factors. Increased VEGFR2 and PGFRB levels in malignant cells of dogs with TCC were noted. Sorafenib may directly target tumors and inhibit angiogenesis by targeting VEGFR2 and PGFRB, which are expressed on canine TCC. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.